Hello, everyone. My name is Hannah Smucker, and I am a graduate student in the Masters in Dietetic Internship Program at Eastern Illinois University. Today, I'm going to be presenting my systematic review for class NTR 5600. My topic for this presentation is health effects the ketogenic diet has in women with polycystic ovary syndrome. Thank you all for listening, and I hope you enjoy. Here is an overview of what this presentation will entail. First, I will begin with the introduction by introducing this topic, going over key terms and definition that the research focuses on, as well as the statistics about the topic, and then I will explain why I chose this topic for my research project. Next, I will go over the purpose statement for my research. After that, I will talk about the methods section, which includes how I found my data, as well as the steps I took throughout the research process. We will then go over the results of the research and discuss what the results mean, as well as strengths and limitations to the results. To finish up the presentation, I will end with a conclusion about the topic and discuss any further research needed for my topic. To start off this presentation, I am going to go over key terms and definitions and go a little more in depth about what they are and why they are important for this research topic. The three terms included are the ketogenic diet, polycystic ovary syndrome, and endocrine disorders. The first term I will go over will be the ketogenic diet. This can also be called the keto diet, KD, and low carbohydrate diet. The ketogenic diet is a high fat, moderate protein, and low carbohydrate eating pattern. The goal for a ketogenic diet is to consume less than 50 grams of carbohydrates a day. Now, individuals that tend to do the ketogenic diet usually try to consume about 15 to 20 grams of carbohydrates per day. This process induces a metabolic condition called physiological ketosis. This is different from ketoacidosis, which is seen in individuals with diabetes mellitus type 1 and can even be life-threatening. So, what is ketosis? The keto diet limits the consumption of carbohydrates, which are the main source of energy in the body. The body then has to replace the missing carbohydrates with an alternative energy source. This alternative source is known as stored fats. The body breaks down the fat into ketones, and the ketones become the new fuel and energy source for the body. The ketogenic diet was first discovered in 1921 by a guy named Russell Wilder to treat children with epilepsy. Soon after the diet was discovered, it lost its popularity due to a new anti-epileptic medication that was introduced. The ketogenic diet gained back its popularity in the 1990s, where it was revealed to also be used as a rapid weight loss diet. The ketogenic diet is now one of the most known fad diets circulating the news and media. So there are multiple different types of ketogenic diets. This includes the standard ketogenic diet, cyclical ketogenic diet, targeted ketogenic diet, and high protein ketogenic diet. The standard ketogenic diet is a high fat, moderate protein, and low carbohydrate diet, as I just mentioned earlier. The ratio for this keto diet is 70% fat, 20% protein, and 10% carbohydrates. The cyclical ketogenic diet focuses on 5 days of ketogenic diet and 2 days of a high carb diet. The targeted ketogenic diet is a diet that allows you to add more carbohydrates around workouts. Lastly, the high protein ketogenic diet is comparable to the standard ketogenic diet. However, the diet includes less fat and more protein. So the ratio for this diet is going to be 60% fat, 35% protein, and only 5% of carbohydrates. The cyclical keto diet and the targeted keto diet are mainly utilized by athletes and bodybuilders. The standard ketogenic diet is a diet that is being evaluated in all my primary articles. So another aspect to consider when an individual is on the ketogenic diet is intermediate fasting. This can help benefit the ketogenic diet because it helps the body enter ketosis faster. Intermediate fasting typically implicates limiting your food intake to approximately 8 hours out of the day, and then fasting for the other 16 hours. It is common for an individual to fast from noon to 8 p.m. So there are also specific ways to determine if you've entered ketosis, and those include an increased thirst, dry mouth, frequent urination, and decreased appetite. So real quick, we can go over a list of foods to limit or avoid when you are on a ketogenic diet. This includes sugary foods and drinks, grains and starches, alcohol beverages, root vegetables, beans, legumes, unhealthy fats, most fruits except for berries, candy, pudding, anything along those lines. And so a list of foods to more focus on for your meal when you're on the ketogenic diet includes meats such as steak, bacon, chicken, turkey, fatty fish like salmon and tuna, eggs, unprocessed cheeses, nuts, seeds, avocados, or any healthy fats, low carbohydrate vegetables such as peppers, onions, tomatoes, green vegetables, and healthy oils. The next term we will focus on is polycystic ovary syndrome. Throughout the rest of this presentation, I will mainly refer to it as PCOS. PCOS is one of the most common endocrine disorders in women. It is a heterogeneous hormonal disorder that affects females of reproductive age. Individuals with PCOS may experience symptoms such as menstrual irregularity, insulin resistance, excessive male hormone levels, which is known as hyperandrogenism and or hyperandrogenemia, and physical signs including acne and hirsutism, also known as excess facial and body hair. The ovaries may lack follicles and fail to regularly release eggs, which can make a woman infertile. Infertility is one of the main concerns when it comes to PCOS. The cause is still unknown for PCOS. However, it seems that insulin resistance, hyperinsulinemia, and low-grade inflammation play a key role in the pathogenesis. Environmental factors, genetics, and interactions also may be linked to the etiology of polycystic ovary syndrome. There is no specific diagnosis for PCOS, but a doctor might advise the patient to get a pelvic exam, blood tests, an ultrasound, and or a physical exam to check for PCOS signs and symptoms. Treatment for PCOS will include managing the individual's concerns, lifestyle changes, and medications. The individual concerns can include infertility or obesity. Lifestyle changes include a change in diet, moderate exercise, and weight loss. Even just losing a little bit of weight can improve a patient's PCOS conditions, as well as increase the effectiveness of PCOS medications, and this can help with infertility. A doctor may prescribe medications to regulate menstrual cycles, to help ovulation, or to reduce excess hair growth. The prevalence of PCOS is about 15% to 20% worldwide, which has increased over the years as it used to only be 5% to 8%. 50% to 70% of individuals with PCOS suffer from insulin resistance. If a woman with PCOS suffers from insulin resistance, then it is likely to be associated with obesity, cardiovascular disease, or metabolic syndrome. With that being said, about 50% to 60% of women with polycystic ovary syndrome are overweight or obese. The symptoms of PCOS tend to be more severe in obese individuals with this disorder. And PCOS can also increase the risk for hypertension, coronary heart disease, diabetes mellitus type 2, certain cancers, and dyslipidemia in women. Individuals with PCOS may experience physiological issues as well as those including depression, anxiety, poor body image, and reduced quality of life. Other complications can include gestational diabetes, miscarriage or premature birth, sleep apnea, and abnormal uterine bleeding. With PCOS, it is very important to maintain a specific diet and exercise regularly. As mentioned earlier, if an individual is obese with PCOS, losing just a little bit of that weight could improve the condition. This includes restoring normal function of the ovaries and can result in normal hormone production. Subsequently, this can lead to improvements in PCOS symptoms such as menstrual regularity, acne, and excessive hair growth. Lastly, I briefly want to go over endocrine disorders. Endocrine disorders result in an increase or decrease in hormone levels in the endocrine system, as well as tumors and lesions. This system includes the pancreas, the thyroid, the parathyroid, pineal, hypothalamus, adrenal, and pituitary glands, and the ovaries and testes. The endocrine system produces and releases hormones which can affect growth and development, sexual function, and metabolism. Some of the most common endocrine disorders include PCOS, all types of diabetes, hyperthyroidism and hypothyroidism, and Cushing's disease. So why did I pick this topic? There are so many fad diets trending these days, and it's hard for individuals to keep up with them and know which ones are good. When people find out that I am a dietetics and nutrition student, they always have some kind of question they want to ask, or they want to know my opinion on a certain topic. For some reason, the most asked question I get is usually about the ketogenic diet. I've had multiple coworkers and friends attempt this diet at some sort of point in their life. I've heard positive and negative outcomes of the ketogenic diet, and I've always just been very interested in doing more research on this topic. So with that being said, the purpose of this study is to examine the different type of health effects the ketogenic diet has in women with polycystic ovary syndrome. Next, I will go over the methods section for this project. This includes the steps I took to find my research articles, as well as the data and information found. For my research, I used 3 electronic databases through Eastern Illinois University's Booth Library to find my primary sources. These databases were Academic Search Complete, CINAHL Plus with full text, and Google Scholar. 3 of my primary articles were discovered in Academic Search Complete, while there was 1 from each in CINAHL Plus full text and Google Scholar. I had a specific search criteria that included the terms polycystic ovary syndrome, or PCOS, ketogenic diet, keto diet, or KD, or low carbohydrate diet, or low carb diet, and as well as a mixture of all these terms. So at first, I was having difficulties finding articles that met my inclusion criteria, so I set up a meeting with Andy, who is the reference librarian, and he suggested several ways to uncover articles that I never would have found without his assistance. He revealed how to search for articles and look into the authors to see other work they have produced, and I also learned how to view a specific article and find other article reviews that used it as a citation. Andy was extremely helpful in every step of my research project. After researching articles and switching around my terms, I ended with 16,114 total articles. I will discuss this more when I go over my PRISMA flow diagram in a minute. For now, I will go over my inclusion and exclusion criteria lists that combined the total number of articles found to my primary articles. The inclusion criteria included articles published within the past 10 years, so from 2010 to 2020. However, I did have 1 primary article that was from 2005, and I will explain that very soon. The rest of the inclusion criteria included a focus on the ketogenic diet and polycystic ovary syndrome, female participants only, peer-reviewed articles, included the whole article, and the results included health effects. The exclusion criteria are essentially just the opposite of the inclusion criteria. It excludes articles published before 2010. It does not include information if it does not include information on the ketogenic diet or polycystic ovary syndrome. Includes male participants, was not peer-reviewed, only had partial of the article, and if it did not include any health effects of the topic in the results. One issue I kept running into was finding primary articles that were in my inclusion criteria year range. With that being said, one of my primary articles was published before 2010, but I merely included it because it provided excellent information and the results were similar to my other primary articles. Now, I will go over my PRISMA diagram that helped me find my primary articles. I use this diagram to stay organized with my articles. PRISMA is an evidence-based tool that is used for reporting in systematic reviews and meta-analysis. It is designed for authors and journal peer reviews. When I started this research project, I wanted to focus on the general health effects of the ketogenic diet in women. However, that was too broad of a subject, which is why I decided to incorporate criteria for women with PCOS. So as previously mentioned, my search terms were polycystic ovary syndrome, PCOS, ketogenic diet, or keto diet, or KD, and low carbohydrate diet, or low carb diet. I used each term individually as well as a combination of the terms. The search terms yielded 16,114 articles in the 3 databases I used. The only inclusion criteria that I assessed during this step was peer-reviewed articles. I utilized an additional 3 records through other sources, bringing my total number of articles to 16,117. After removing duplicated articles, I was left with 16,081 articles. Next was the screening process, where I ended with a total of 30 articles after viewing the purpose statement and abstracts of each. I briefly analyzed the studies and decided to exclude 17 more articles, which left me with 13 articles that were assessed for eligibility. I thoroughly reviewed the last 13 articles with my inclusion and exclusion criteria, eliminating 8 of the articles. 5 were excluded for being published outside of 2010 and 2020, which was my year restriction. 2 were excluded for not providing the full article, and 1 was excluded because it did not specify any health results or health effects in the results. After this whole process, I was left with 5 primary articles. 4 of the articles were quantitative, while 1 was qualitative. However, they appear to be mixed methods. I will be going a little more in depth with my primary articles to compare the 5 studies with my data extraction chart. I used Microsoft Excel spreadsheets to break down my information, and I utilized 7 different categories for this. These categories include the author, the year the study was published, the duration of the study and the study design, information on the participants, the purpose statement of each study, evaluation measures, and the results of each article. The first article was conducted in 2018 and lasted 6 months. Every month, the participants would come in for appointments for a brief review and assessment. The study design for this article was a case series. There was a total of 8 female participants. However, 4 were excluded due to non-compliance with the diet, leaving only 4 participants with an age range of 24 to 29. The purpose of the study was to characterize the metabolic and reproductive profiles with a diagnosis of PCOS who initiated a low carbohydrate or ketogenic diet. BMI, weight loss, and symptoms of PCOS were evaluated in the study. The results concluded a decrease in BMI with an average weight loss of 11.2 kilograms, as well as improvements in menstruation. The second article was conducted in 2013 and lasted 20 weeks. There were 2 arms of the study, each lasting 8 weeks with a 4-week wash period in between. The study for this article was a crossover study. At the beginning of this study, there were 30 participants, but only 27 ended up completing the low carbohydrate arm of the study. All the participants were female with an age range of 21 to 50. The purpose for this study was to examine the effects of controlled treatment with 2 caloric diets differing in carbohydrate consumption on beta cell responsiveness, serum testosterone contraction, and insulin sensitivity in women with PCOS. BMI, weight loss, HOMA-IR, fasting insulin, fasting glucose, testosterone, total cholesterol, HDL, LDL, and triglycerides were evaluated in this study. The results concluded a decrease in BMI, HOMA-IR, fasting insulin, fasting glucose, and testosterone, and an increase in insulin sensitivity. The lipid profiles significantly improved as well. The third article was conducted in 2005 and lasted 6 months. This article was an exception to my inclusion and exclusion criteria because the data was excellent and I thought it would be beneficial to include it in my results and discussion. The design for this article was a pilot study that included 12 eligible participants. However, only 5 completed the study due to failure to complete the study or they failed to attend the follow-up visit. The participants were all female with an age range of 18 to 45. The purpose of this article was to investigate metabolic and endocrine effects of a low-carbohydrate ketogenic diet on overweight and obese women with PCOS. The evaluation measures included BMI, weight loss, total cholesterol, HDL, LDL, triglycerides, fasting insulin, fasting glucose, testosterone, and LH and FSH ratio. The results concluded a decrease in BMI with an average weight loss of 6.9 kilograms, as well as a decrease in testosterone, FSH, LH, fasting insulin, and fasting glucose. It also displayed improvements in hair, infertility, and menstruation. The lipid profiles changed, but none reached statistical significance. The fourth article was conducted in 2020 and lasted 12 weeks. This study is also the research article I provided for you all. The design of this review was a single-arm study. It started with 24 participants, but due to exclusion criteria and participants leaving, the study was completed with only 5 participants. All the participants were female, with an average age range of 18 to 45. The purpose statement was to determine the effects of a ketogenic diet in women of childbearing age with a diagnosis of PCOS. The evaluation measures included body weight and BMI, fat body mass, lean body mass, fat body mass percent, lean body mass percent, glucose, insulin, HOMA-IR, total cholesterol, HDL, LDL, triglycerides, testosterone, FSH, LH, and SHBG. And this is basically why I chose this for my primary, or the article to send to you guys, because it included so many important factors that were throughout the other studies, but not the other studies didn't have all these results. The results concluded a decrease in BMI with an average weight loss of 9.43 kilograms, as well as a decrease in fat body mass, lean body mass, glucose and insulin, HOMA-IR, LH, and testosterone. There was an increase in lean body mass percent, FSH, and SHBG. The lipid profiles also significantly improved. The last article was conducted in 2019. The duration of the study varied from 1 week to 24 weeks. A meta-analysis was performed utilizing data from randomized controlled trials. There was a total of 327 female participants, but the exact age range was not specified. The purpose of this study was to assess the effects of a low-carbohydrate diet on women with polycystic ovary syndrome. The evaluation measures of this study included BMI, weight loss, HOMA-IR, FSH, SHBG, testosterone, total cholesterol, and LDL. The results concluded a decrease in BMI, total cholesterol, LDL, testosterone, and HOMA-IR, and an increase in FSH and SHBG. So I want to go over the article I selected to send to you all. I picked this article because it was well written and explained the information the best, even though the results were similar to the other studies. For this study, there were 24 female participants enrolled through public announcements within medical centers in northern Italy. Even though 24 participants were enrolled, 6 women were excluded due to current PCOS pharmacological therapy and 2 for clinical hyperthyroidism. 2 weeks after the study started, 1 more participant left and 1 removed herself before the follow-up visit. That's a total of 10 participants excluded, leaving 14 that concluded the study. The inclusion criteria for the participants in the study were as followed. They were overweight with a BMI that was greater or equal to 25 kilograms per meter square, had a PCOS diagnosis, were within fertile age, which is 18 to 45 years old, had a desire to lose weight, and agreed not to use contraceptives during the experimental period. The exclusion criteria included pregnancy and lactation, hormonal therapy and/or insulin sensitizers, hepatic, renal, and heart disease, and local treatment for hirsutism, which is the excess hair growth. Before the study commenced, the participants underwent a comprehensive medical history questionnaire and physical exam. It included anthropometric measurements, body composition analysis, blood exams, and a diet composition. A statistical analysis was used to compare the data before it began and first after the study had concluded. An t-test was used, and all the data was articulated as a mean plus or minus standard deviation. The results indicated an average weight loss of 9.43 kilograms as a significant reduction of BMI and fat body mass. Lean body mass absolute value had a significant decrease. However, the percent value of lean body mass had a slight increase with a general improvement in body composition. Glucose, insulin, and HOMA-IR all showed a significant decrease. Changes in the lipid profiles included a decrease in triglycerides, total cholesterol, and LDL, along with an increase in HDL levels. Lastly, the plasma concentrations of LH and testosterone were significantly decreased, while FSH and SHBG were slightly increased. To conclude, the results suggested that the ketogenic diet can be utilized as a potential therapeutic aid in PCOS patients. The other primary articles for this review have similar findings, and we will go over those soon. To begin my results, I'm going to start with the breakdown. My results consisted of mixed outcomes from the 5 primary articles. As mentioned in my PRISMA diagram, my initial search yielded 16,114 articles from the search criteria I mentioned earlier. I then removed the duplicate articles, taking that number down to 16,081 articles. I screened the articles and assessed the remaining for eligibility, which is where I got my 5 primary articles. Out of these 5 primary articles, there were 377 participants with ages ranging from 18 to 50. All participants were female because part of the inclusion criteria for each study was a PCOS diagnosis. The locations for my primary articles included Italy, the United States of America, and China. 3 articles were conducted in the US, while 1 in Italy and the other in China. I did not exclude any location since polycystic ovary syndrome is a universal disorder. As I just mentioned, my primary articles contained mixed results due to the fact that not every article had the exact same health effects that were studied. With that being said, overall, each health effect that was in multiple studies concluded the same results. 100% of my primary articles resulted in weight loss and a decrease in BMI. 60% of the studies showed a significant improvement in menstruation in women with PCOS. 4 out of the 5 studies showed changes in lipid profiles. However, only 3 showed improved statistical significance. These studies indicated a change in testosterone is positively associated with a change in fasting insulin, as well as a general improvement in insulin resistance. It also suggests an improvement in insulin resistance with a reduction in insulin while maintaining fasting glucose and hemoglobin A1C levels. Overall, there was improvement in body composition and a significant decrease in fasting glucose, fasting insulin, HOMA-IR, LH, testosterone, and insulin resistance. This also indicated an increase in FSH, SHGB, and insulin sensitivity. All of these results showed beneficial improvements for women with PCOS. In this discussion, I will briefly go over my results again and clarify what they mean. I will then discuss the strengths and weaknesses of the primary articles. So just to refresh, my purpose of the study is to examine the different types of health effects the ketogenic diet has in women with polycystic ovary syndrome. All of my primary articles suggested an overall benefit of the ketogenic diet in women with PCOS when it comes to weight loss and other anthropometric measures, metabolic biomarkers, and endocrine biomarkers. As we just talked about, this includes a significant decrease in BMI, fasting glucose, fasting insulin, HOMA-IR, LH, testosterone, and insulin resistance, and a significant increase in FSH, SHGB, and insulin sensitivity. Overall, the studies revealed improvements in body composition, lipid profiles, and menstruation. Obesity is clearly associated with PCOS, thus higher BMIs are correlated with a greater prevalence of menstrual irregularity, hyperandrogenemia, and hirsutism. The studies demonstrate how the ketogenic diet could be an effective treatment for restoring normal menstrual cycles, ovulation, therefore improving fertility, and reversing insulin resistance. The potential for utilizing the ketogenic diet as a therapeutic option in women with PCOS noticeably has its advantages. I will now go over the strengths and limitations of my review. The strengths of my study include articles that were conducted globally. As previously mentioned, my primary articles took place in the United States, Italy, and China. This is important for my research because PCOS affects women all over the world, and it can be beneficial to compare the data from each country. My inclusion criteria was also considered as a strength of the study because it significantly assisted my search for my primary articles. Lastly, the utilization of Prisma and my data extraction chart was a strength of my study because these two elements kept me organized and on a precise track in my research process. The limitations of this review include small sample sizes because 4 out of my 5 primary articles included 23 participants or less. If there were more participants, the accuracy and reliability of the study would be more precise. And not all my primary articles were included in the inclusion criteria year range. So as previously mentioned, one of my studies was from 2005. However, the data and results were too good to exclude from my research. Another limitation to my research is not all the anthropometric data, metabolic biomarkers, and endocrine biomarkers were tested in each study. However, each study had a different combination of the data and results. For example, say 3 of the articles could show improvements in menstruation while all 5 showed a decrease in BMI and weight loss. This makes it difficult to completely compare the articles and the results, which is a limitation. To conclude this presentation, I will go over a summary of this review. The objective is to examine the different types of health effects the ketogenic diet has in women with polycystic ovary syndrome. The design: a systematic review was conducted with present-day literature using 3 electronic databases between the years 2005 and 2020. These databases included Academic Search Complete, CINAHL Plus with full text, and Google Scholar. Inclusion criteria included the year the article was published, so within the past 10 years, a focus on polycystic ovary syndrome and the ketogenic diet, female participants only, peer-reviewed articles. It had to include the whole article, and health effects needed to be included in the results. A Prisma diagram and the Academy of Nutrition and Dietetics Evidence Analysis Manual were both utilized in this review. For the results encompassed a total of 16,114 articles, of which 5 articles met the inclusion criteria to become the 5 primary articles. All the articles discovered beneficial health effects in women with polycystic ovary syndrome who followed the ketogenic diet. So for the conclusion, the evidence supports the ketogenic diet as a potential therapeutic aid for women with PCOS and provides overall improvements in anthropometric, biochemical, and endocrine measures. Future research is needed on this topic, which we will go over next. Lastly, we will go over the implications for current practice and future research. So future research needs to be conducted for several reasons. Aspects such as duration of the study and sample size need to be researched more. I think future research could benefit from using a larger sample size, as well as comparing the results from a short-term and long-term study. One of the articles briefly mentioned side effects participants did or did not have in result of the study. So, studying the side effects of the ketogenic diet in women with PCOS could provide valuable information to healthcare providers or registered dietitians in the future. For this study, I only focused on PCOS, but throughout my research process, I noticed other endocrine disorders that were being researched for ketogenic diet effects as well. We could look into the difference the ketogenic diet has on the other endocrine disorders. And I also thought it would be favorable for future research to establish if these health effects are actually due to weight loss or if they are due to the specific diet in these studies. Overall, there is a gap in the literature, and it would be beneficial for more research to be done on this topic to provide more reliable and concrete evidence in the clinical setting. This concludes my research presentation. I hope you guys enjoyed, and here is a list of references that were used and cited throughout my whole presentation. Thanks.